the joint mobility, this is where chiropractic comes in. Because I think this machine combined with chiropractic is literally the best thing that you can ever do for your body. Because the chiropractic is going to take care of the structural stress, the joint mobility, the stress on the nervous system. Then this thing is going to accelerate the localized healing of the joint. So to be combined, I believe that this is the future of healing. And we're trying to push this as much as we could so we can do that. So you're in the right place. You're going to heal. It's just going to take time. Well done. Good job. Awesome. All right, here's your shoes.
How was it?
So you're doing your lower back, huh?
Yeah.
So he has a lower back injury that we're going to deal with. Now what, it was an accident, you got hit from the front.
I got hit from the side. So if it was, say that's the SUV where the mirror is, it hit me.
And you were on a bike, you
I was
said.
on an electric unicycle.
Unicycle?
Yeah.
Oh wow. So that's
So I don't even know if that, I'll show you what it is. And
I'm glad that you're in much better condition than it seems like you would have if you got into that accident.
oh man, it was.
How long ago was it?
It was April 27th.
April of this year?
Mm-hmm.
And what have you been dealing with so far?
Well, the fractured left ankle.
Fractured left ankle, which is healing?
Yeah, it's healing. It's still weak. It's a little stiff. But overall, it's way better than it was.
Okay.
The left knee. Now this left knee is still a little swollen, and I still have some pain in that.
Got it.
And then the lower back is the one that I feel usually when I get up in the morning. It starts like right, like not on the spine, but like right just to the left of it.
Okay.
And then it just moves
into there.
up and down. Yeah.
Do you have pain in that lower back right now?
Yeah, it's in there.
Yeah.
You hit the right area, it's there.
Yeah.
Or depending on which way I turn.
And can you
feel it.
say on 0 to 10 what that is?
Morning time, I would give it a 10.
Morning time 10.
And then it starts to loosen up.
And
And then it depends on
what's going on. Is there certain movements that make it worse? Or maybe certain activities?
I would, depending on which way I turn, or if I'm going to lift something up, I can feel it. Like if I lift it up this way, I can feel it like right back in here.
Got it.
Yeah.
So right now you're not at a 10 though, right?
No, I'm not at a 10 right now. Right now I can't really feel anything.
Got it.
But if I, depends on what position I'm in. You know,
Okay.
and that's when, you know.
And you can pinpoint with pressure right now where it is.
Yeah, it's like right
there.
Right here.
So you can feel that. My goal for you is after we do this treatment, you're not going to be able to find that pinpoint.
Okay.
That's my goal for you. Because you don't have as much like I'm a 10 on pain, but you have something that, so I always want to try to come to how can we know that this helped you? So I'm thinking that trigger point that you're finding right there.
It's right here. Right?
Yeah.
Do you feel it when you bend over?
How about when you bend over? Yeah, that's a good one.
No, when I bend over, I'm good.
Yeah.
It's just depending on what way I turn. Like right there.
You felt that?
I felt it right in here.
Did it shoot down the leg or just stay local?
It's just staying local right
Good.
now, but it moves.
Okay.
Sometimes it moves out. I can feel it right here.
Okay. All right, so we're going to treat both sides of your lower back and hips, but we're going to concentrate on the areas that are most inflamed. Sound cool?
Yeah.
So I don't have to really explain the whole thing because I just did. So like I said, to her, you're either going to feel one of two sensations, either absolutely nothing or what feels like a little hammer hanging. Cool. Let's have you on your face down here.
Okay. I need to take my shirt off?
No.
Okay.
Let's give you some.
You want to use the camera here or not?
No, did you want it? Did you record?
Let me see if I can. I think we got it.
All right, so I'm going to clean this applicator head. You want to see the applicator head?
Okay. I think that's good. I think. You just use alcohol like that?
Yeah, just alcohol wipes will be fine.
Okay.
And just clean the applicator head.
You gotta stop it. Just get low.
Is it recording now?
No, it's not recording now. Just press the red button. I'll start the record.
Do you do video for your career? Are you a videographer?
No, I do have a YouTube channel.
Fine.
It's like a little bit of everything. So it's like a variety channel.
Cool. I have a YouTube channel, but I'm not very active on it. I wish I was more active. All right, cool. So with the lower back, we are going to go underneath the waistline. So I am going to bring this up.
Okay.
But I am going to put this paper towel to protect your pants.
All right.
We go right above the butt line. You can do it. There we go. Perfect.
You guys looking to do that actually.
What?
On the side, right? First video.
What, video?
Like any people that need videos, they're not do it. You know what I mean?
That's cool.
Yeah.
All right. So when it comes to the lower back, Dr. Sari, we start on the sacral plexus. So we go to both SI joints up top, SI joints on the lower part, and then the middle right by the sacrum. Then we kind of work our way out to the hips and up the lumbar spine. But typically they feel most of it in the SI joints and maybe sometimes in the glutes. At least that's what I see.
Yeah, my glutes get like 2 bricks, man.
Yeah, you're gonna love this machine and hate it at the same time. All right,
I'm
so.
not gonna get the click and like jump up to the ceiling.
No, I'm gonna start in an area where you're not gonna feel it, which I don't think you'll feel it up here. So I'm gonna start it at 9. Right, you don't feel anything? You just hear that sound?
Yeah, I'm good. Yeah.
Good. So let me know when you start to feel a little hammer hitting you.
There we go.
Right there.
Yep.
How are we? Can you handle that?
Yeah, I can handle it.
Okay, good. How about if I come out to the glute over here?
Oh yeah.
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 Like more than the SI joint?
About the same, maybe
Okay.
a little bit more intense.
How about if we go on this side? Not as bad?
Right there, yep.
Okay. How about if I come through this?
Oh yeah,
Is this left glute more than the right or about the same?
it's more.
Okay. How about if I come up the spine on the side here?
Spine is good.
Good. How about on the spine here?
On the spine is good.
And then how about on this side?
That's good.
Okay, so lumbar spine looks pretty good, so we're just gonna stay in these
Oh yeah.
areas.
Yep.
I'm gonna go a little deeper. You might feel it a little bit more. You okay?
Yeah, I'm good. That's definitely feel it there. Yeah.
Good. We're gonna
Oh
stay.
yeah.
So we're gonna stay in these regions.
I definitely feel it there.
For the rest of the
I can feel it
time.
going down into the hip.
You're feeling it go into the hip?
Yeah.
Okay. If I go into the hip with the machine, do you feel it?
Yeah.
Okay.
Yeah.
We're gonna stay in these areas. If I go further, you still feel it?
Oh yeah. Yeah. Wow. Yeah.
Okay. So we got some, almost like the hip joint here. If I go lower like that, do you still feel it? Or not?
Not
as
so
much?
much there.
Okay, so we're gonna stay right in here. And I'm just gonna kind of come to these points again. You feel it right here. That's like the base of the sacrum.
No, I'm feeling
Okay,
a
good.
little bit, but right there,
Right
definitely.
there, that's that lower SI joint.
Yep, right there. Holy smokes.
I told you, those SI joints are almost automatic. And then the glute over here.
Yeah, geez,
Okay.
but wait, that feel like bouncing off of the darn cheeks.
We like to say when you feel it that you're, it's a healing pain. You gotta
Yeah.
feel it to heal it. How about on this hip? Do you feel it in this hip?
No.
No. So let's stay in this glute here.
Yep, right there, definitely feel it. Wow. That's
Good.
crazy.
And then we're gonna go back into this SI joint over here.
Woo-wee. Oh yeah.
We're gonna come onto this side again. And then we're gonna go back to the hip over here. Do you feel it?
Mm-hmm.
The same as earlier, or is it getting a little bit better?
It's getting a little better.
Good, that means that inflammation is coming down. Where's the most that you feel it with the machine? Is it this hip? Or is
It
it
was the hip, and then the inside of the SI joints. Is where-
Both of them?
Yeah, that's that, right
Right
in that
there?
area. Yeah,
So let's
right
stay
there.
right here.
Yeah, I really feel it right there.
okay? Good, and then we're gonna go on this side.
Those are areas. Ooh.
Okay. You made it through your first treatment session. Let's clean you up. And then I'm going to ask you the same exact question. When you get up, I want you to tell me if you feel any change from when you walked in this door. You can maybe try to find that trigger point, move the body the way you were before.
All right.
I want to see that first impression. Okay. How's that feel?
Good.
Right, you like that? Can you find that trigger?
I'm working to find it. When I pushed up a little bit, I can feel it, but it's not as intense.
intense.
It's not as intense.
Good.
It's not as intense.
That's what we want to hear.
It's not as intense.
feel any relief, not that I 100% expect it, in the knee or the ankle?
No,
That's still there.
Yes,
Yeah,
yes.
because that's more localized.
Yeah.
Sometimes if we do lower back stuff, we can feel change in the legs.
I can feel, well, right now I feel like more
Little
like,
bit right there.
like tightness. It's
Tight.
like the tightness, like right there.
Less pain, just more
A little
tight.
tight, yeah.
Okay, I'm okay with that. That's improvement, I think.
Oh, yeah. But still, you can definitely feel a difference.
Good.
See, now I can, like, right here, I can feel it.
When you bend down.
Yeah, but it's still not like that sharp. But sometimes you
Not
feel
the
the
stab.
band and you like, you catch it and feel
Mhm.
that jolt.
Awesome.
Oh yeah.
Congratulations.
Thank you.
Got some relief.
Yeah.
Well done.
Wow, wow.